Well, for those awaiting the new COVID-19 vaccine, it's now expected to be released next month. This comes as new coronavirus variant is causing an increased number of cases in the country, according to the Centers for Disease Control and Prevention. It's called EG.5, and it's another Omicron offshoot. As we head into the fall and winter months, experts are predicting there'll be a rise in COVID and other respiratory illnesses. Experts say the updated COVID shot should provide protection against the EG.5 strain. So joining us now to talk more about this is Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control at the University of Kansas Health System. Doctor, thank you for being here. Let's dive right in. So why are experts recommending folks make a plan to get boosted against COVID?
Yeah, I think it's very important as we are going into, further years of SARS-CoV-2 infection. We know the virus is still circulating. We know this has become more of a disease now, though, of those at highest risk, those with older age, comorbid conditions like chronic heart disease, lung disease, kidney disease, and of course, the immunosuppressed. So there are certain populations that it is vital that they get their COVID booster to help reduce their chance of hospitalization, severe disease, and death. And we know these COVID boosters, these COVID vaccines, work very well to do that and are very, very safe.
Well, you see so many of these cases up close. What is one thing you wish people knew about COVID and its impact?
It still is impacting people. It doesn't impact a majority of the United States population. But again, there are certain people that we need in certain populations that we need to be concerned with and protect those most at risk. And again, as we have moved through the pandemic, we have seen that those most at risk, again, continue to be those with older age, with immunocompromise or immunosuppression. We need to be sensitive to their needs, be able to help protect them because they are our friends, they are our loved ones. We know that we have very good prevention methods, i.e. the vaccines. They work very well to reduce your risk of hospitalization, severe disease, and death. And we know we still have very good treatment regimens with our antivirals. So it is vitally important that people, if they have symptoms, get tested early. If they are able to get on the antivirals, get on the antivirals, but nothing beats prevention. So it's vitally important, too, that when the new COVID boosters are available, that especially if you're in those high-risk groups, to get that COVID booster to help reduce your risk of severe disease later on.
When would you recommend getting the COVID booster? I know there's been some confusion around the best time to do that.
Yeah, certainly there is confusion. You're exactly right. I think right now we would start to say when the boosters are available, it'd be okay to go ahead and get your booster at that time. Now, will there be other recommendations later on, as there were previously, that if you are immune compromised, you can go ahead and get a second booster several months later? It's unclear. But we know that the virus is starting to circulate more in the community compared to the last couple months. So I think when it's available, number one, always talk with your medical team and your physician. But when it's available, it'd probably be a good idea to start to think about scheduling to get it at that point in time and help protect you through the fall and winter.
All right, Dr. Dana Hawkinson, thank you for your expertise.
Thank you.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.